Turning right now to the coronavirus in Connecticut. Connecticut continues to roll out those vaccines. First, it was healthcare workers, then frontline workers. Now those 75 and older are getting ready for their shots. Chief Capitol reporter Susan Raff talked to those who are rolling up their sleeves. She's joining us right now with more details. Hi there, Susan.
Mark, this is certainly a lot of things, or a lot, what people are talking about and waiting for. The COVID pandemic has been with us almost a year, and we really want to get through this. And the vaccine, many feel, is our best hope.
They keep telling me that it's going to be a little sore tomorrow, but we'll see tomorrow.
If she's sore tomorrow, she'll deal with it because Luisa Marulanda wants this vaccine. She's an EMT who is exposed every day.
There's sometimes that you are concerned when you go into people's houses. It's an enclosed area. They're coughing up, they're sneezing.
While frontline workers like EMTs, police, and firefighters must wear masks all the time, they are still at risk.
We have to figure out a way to get it to our communities as quickly and safely as we can. So we have to create as much access as possible.
Hartford Healthcare has 9 locations for COVID vaccines, and they plan to have more. The Convention Center in Hartford is where they've been doing much of the testing and now vaccines. The next phase of the rollout is for those 75 and older, but you must register and make an appointment. You can do this online at hartfordhealthcare.org/vaccines, or you can call the vaccine hotline at 860-972-4993. Hartford Healthcare has already started a pilot program for those 75 and older, but it's not yet open to the public. CVS is also getting ready to play a major role in distributing the vaccine to the general public in Connecticut. It expects to eventually administer up to 25 million vaccines a month across the country. Both vaccines require a second dose.
Do I believe some people might miss a dose? I think so. I think our hope is to be able to vaccinate millions of people. There's a potential for that.
While having one dose does offer some protection based on the trials, it's not the complete vaccine. And coming up on Eyewitness News at 6, the challenge of getting these vaccines out. Susan Raff, Channel 3 Eyewitness News.
Okay, Susan, we will see